କରୁଥିଲେ ସ୍ୱରଗ ସମାନ ଆହା ଅଟେ ସେହି ଘର परस्पर स्नेह जही थाए निरंतर मोर परिवार मध्य चारि पाँच प्राणी जो कुटुंब थिला आमे हस खुशी आमर दिन कालतीपात करूँ किंतु 2012 एप्रिल 29 रे मोर परिवार पर दुखर पहाड़ आसी पड़गला मोर हस्बैंड को राइट साइड टंग रे कमर्शियल कार्सिनोमा डायग्नोस होला
मु जने कैंसर पेशेंट मुट्टी के बेस डीप को जीपी जो माने सर्वाइवलिटी अछंती दे कैन अंडरस्टैंड माय फीलिंग्स प्रोग्राम्स एंड ऑल बट माय वन क्वेश्चन इज हियर whenever I am going any educational institution for cancer awareness program and after returning home I am receiving more than 2 calls from each and every institution हमें just discussion कर लो कैंसर जब early stage रे डिटेक्ट हो जाए यानी practically we have to reach to students remote areas, slum areas, and we have to work with them. These are
train accident that happened, and overnight we created volunteer groups.
You feel that you see in managing or engaging volunteers team.
The first thing is the time constraint, the flexibility of time. Many of us are not full-time volunteers. All of us are working in different environment, in different departments. So rarely we find to sit with each other like this. In this forum, we are sitting together and discussing this today. So that is the foremost thing. Then second is the lack of resources and funds. Third is the motivation. Motivation or the lack of recognition to the volunteers. So you have to motivate them and giving them some form of incentives or by some form of recognition to the volunteers so that they won't be demotivated later on and there won't be any burnout.
Thank you. I think somebody is noting these wonderful points he has shared about incentives and how to keep them motivated, which is a very valid and practical point because I think someone else was saying that khali kahile kon hobo practically am career achi and how to retain. So I think these are valuable points. Thank you. And okay, how do you overcome that? I think your answer is already in that. So if we take care of these points, yeah. Thank you very much. We are moving on to the next question. My question is to Sri Govinda sir. What qualities do you feel make a volunteer team strong and dependable?
Thanks. I think all of you might have seen this movie called Ananta. I think these Anantas are still available, though it was written in Fakirmon's time. And as we work in a resource-scarce communities, mostly in the tribal hinterlands, with very limited, even colleges or having student volunteers is very difficult. These Anantas really come. There are a couple of Anantas here which I have brought. The Anantas are typically the different kind of breed of people who are jack of all trade, and they do it full-time volunteering. Though we have a concept of volunteering as a part-time, I think you can find full-time volunteers and part-time workers. That gives dividend in running such volunteer network. We did a massive psychosocial care after this, train accident that happened, and overnight we created volunteer groups to manage uncertainties, to manage their family relations, communication, and I think resource. I don't think it is a constant when you have the right intention. किंतु मैं यति की कहिबी आमे जो जनरेशन देखि जाउछु आमे माने गांधी गोपबंधु को ओडिशा करे खोजुछु आमो पिला माने कैरियर करिकी करंतु वॉलंटियर जो माने बेकार अछंती सेइटो खोजुछु राजनीति होची ओटे वॉलंटियर में सेति भी बेकार लोक को खोजुछु तेनु मोर कहया तो जो सैंक्टिटी ऑफ द प्रोफेशन से सैंक्टिटी ऑफ प्रोफेशन पे आमे गोटे जिंस करू जेमति को कहली से माने मल्टी टैलेंटेड हेतिबे डाइवर्सिटी थिबो आ मोस्टली 17 इयर्स हला रेसिडेंशियल डिएडिक्शन सेंटर चले के हमर ओटे अनुभूति होची जो माने लिव्ड एक्सपीरियंस देखि थे तांको टू बेटर वॉलंटियर्स ऑफ एरिया
एब्सोल्युटली एग्री with you. Yeah, thank you very much. So well said actually. जो सत कथा आपण जरा कहिले We can start from our own house itself. Yeah, thank you. And I think apart from Dr. Manas, we have Dr. Mami, and I'm a bit curious to know as a doctor what she feels. What actually kaun hava katha about volunteer qualities. Over to you, ma'am.
Thank you, Sonanda. Amritara start hua dinru, I always speak about going to interior, how to reach the interior. So most important is how to support those volunteers who are working. And when we talk of cancer, and I can talk of palliative care, challenges are tremendous. Even as doctor, I face a lot of challenges while dealing with those type of cases. ସେଥିପାଇଁ ସେମାନଙ୍କୁ support କରିବା system ଟା ବହୁତ ଜରୁରୀ. ତାପାଇଁ we have to develop strategy how to do that. We can have helpline number, dedicated organizations can work for the volunteers to support them. But without volunteers, cancer care is incomplete or impossible. So trained volunteers is the key.
Thank you, ma'am. Yes. So I think to come to the end of the panel discussion, I want Govind sir to tell कौन गोटे message देबे आपण की advice देबे जे जो माने emerging volunteers अछंती कि पास माने हवा को चाहउचंती बा NGOs रे कौन केमती करो to build strong team and collaboration. I think not only in cancer but as a whole, maybe.
Yeah, Ajay mentioned that the kind of crisis that our generation is facing, we need dedicated leaders who run only voluntary initiatives, because by the time you become empathetic to anything that is happening around you, you are tempted to start working, and like that famous Abhay story, that lady who could not deliver in an institution has 17 reasons, from bridges, corrupt officers, to not having food. So that kind of an interrelational linkage, then you can develop and build perspective around people coming around you. So that empathetic leadership and being inclusive in your approach and that interconnectedness, that is something very essential for running volunteer race. Otherwise, people may come, you have concept of paid volunteering and sometimes euphoria. Sometimes many of the students come to get certificate to get admitted in outside India. There are compulsion sometimes. Best of the people approach for their kids, not even coming one day for the volunteering. With all these ethical dilemmas, still you have to navigate through. So I think we have to chart out our ways.
Thank you very much, and thank you. So we move on to the second question. My second question will be to Dr. Jagannath. So. How important is networking within volunteers between NGOs and with the health system for effective cancer care outreach? How important it is? Your take, sir. Is it audible at all? Yes.
There is an organization called Swasthas for Us. But a doctor from Bangalore, she had come as a sister here, Sister Aquinas. She started in the year 2014 and it's now almost 12 years. She is working in Thuamur Rampur block where she Kalandile. She got a Panchayat Bhavan lease nekiri, 200 tanga rent nekiri, she hospital chalautele. Now it has become, because of the donors, it has become around 10-bedded hospital there. It has come up like that. And she has worked with this organization that we belong to. We work with only with the community volunteers. जो delegate अपने कोरापुट विषय कोइले, Korain is also the first thing. When we entered there, say the 18% was the modern health facilities में पर आसन. Baki they go for the traditional healing and all this. That change has brought 60%, 70%. And we were talking about malaria, tuberculosis, all these things. Cancer विषय किसी बात था ही नहीं. The NGO has a presence. NGO where people, the government cannot reach, NGO has presence. So that we have a presence, we can have we have also set of volunteers not trained in cancer. So there's a huge scope to tap this potential of the NGO and the volunteers into cancer awareness programs. Because NGOs will only work with this funding. Let's accept that fact. HIV/AIDS program funding thala 10 वर्ष खूब कर लेकर NGO. So that happened that way. So you need funding, and funding is available. We started with around 20,000 rupees from our pocket, and it's now a 13 crore hospital being run because of funding from all over India. So it's about a funding bill. So that kind of funding has to be mobilized, whatever voluntary society for training and all these things. There was one small question for the volunteers. Yes, volunteers need motivation. but they also need remuneration. We cannot deny that fact. So when गाँव पिलावड़ा से कहीं का अपने विषय में काम करेंगे, they need remuneration. Let's happily say they need remuneration. Why should we tell we should not do it? But NGOs has a huge potential. We can tap these NGOs with the health system and with these volunteers. We can get the cancer outreach programs more successfully and need a proper structured data about it. There is absolutely no training. I tell you, even the doctors who pass out from medical college are not trained in oncology. MBBS course, they don't go to oncology wards and all. They don't have any training. Counseling to charity, they don't have any training in the treatment also. So it's very important that we train these doctors who are working in the periphery.
Thank you, sir.